Welcome to the Redcliffe Intensive Care Unit. This is where we care for the most unwell patients in the hospital. This video will explain your loved one's admission to ICU. While we are busy with your loved one, our staff will ask you to wait in the waiting room. The staff will be busy preparing the equipment to support the vital organs that need help. The nurses prepare specialised drugs that will also help in the recovery process.
Hi, my name is Carolyn. My daughter was admitted into ICU recently. Unfortunately for our family, she's been admitted into ICU a few times over a period of 10 years. So I can relate to where you are now waiting. I felt sick to the stomach, anxious, and was of course extremely worried. So my aim here today is to help you understand the process of ICU and what you can do to help your loved one. I would like people to know that they can have confidence in the staff at the ICU and trust in their skills. This doesn't mean that you don't have a say or an input into the care of your loved one. Actually, it's the opposite. They want your attention, they want your information and all the relevant details you can give them of your loved one to help create a clearer picture and give the best care possible for your loved one.
After your loved one has been admitted and stabilised, the intensive care team will meet with you to tell you what has happened. They will also need any vital information that could help with the patient's care. It is really important to know about chronic medical conditions, medications, allergies, smoking, and alcohol intake, as these can all impact on the patient's recovery. Sometimes if we know where you have been, like on holidays, or for routine checkups with your dentist, it can really help us find what is wrong.
Hi, I'm Jackie. I'm Sarah, a patient who was a patient in ICU. I'm her mother-in-law. She's been out of hospital now 3 weeks, and just came here to try and help you out so you know what's the go when your loved one's in intensive care. The family meetings were really helpful. When they first called the first one, we were a little bit anxious because we didn't quite know what was in store, and the fact that they were calling all of us in, we were even more anxious. But once we all gathered and we went in and the doctor was there, it was really helpful. They told us exactly what was happening and what was going to be happening, so that relieved a lot of anxiety and a lot of stress. And the fact that afterwards also we could ask questions at any time, and he was really good that he answered every question that we had. So that was really good, because then we knew that what was going to be happening, and then it relieved a lot of anxiety. So we were more informed we were, the better it was. So then we could actually help each other out too, because we all knew what was going on, especially with the family meetings. We were all there, so it helped everybody out.
As hard as it may seem, the suggestions I have for you here in the waiting room is to be proactive. Try and make a list, write down everything relevant to your loved one's condition. Medications is so important, whether you have changed medication recently, introduced a new one, stopped past medication, and even if the doses have been changed from increase or decreasing, it's all important for your loved one's condition. Even think of the behaviour of your loved one over the last few days. Have they been under any extra stress? Undertaken any strenuous activity? How's their sleep patterns been? Or have they had changes to their diet? All this information is relevant to creating a clearer picture for the doctors and yourself to work together to help work out a plan for the recovery of your loved one.
Hi, my name is Monique. I am one of the social workers that work in intensive care at Redcliffe Hospital. Most families and patients in ICU will meet a social worker at some point during their stay. I can provide counselling and practical support to assist patients and their families through the ICU journey. We acknowledge that the ICU journey can be very challenging. Therefore, I explore the patient and family's current social situation to ensure we are supporting you the best way we can be. We acknowledge the social impact on patients and their families as a result of the ICU admission. I can assist patients and their families with practical issues that may arise through problem solving and advocacy support. For example, liaising with Centrelink, employers or housing services.
Each time you enter the intensive care, you will be asked to wash your hands.
Hygiene is paramount in the ICU. You'll be asked to wash your hands every time you enter the unit and possibly put on a gown. This is for your protection, your loved one and for others in the unit.
We encourage patients to have time to rest and keep their normal day-night pattern. We do this because it helps with orientation and recovery time. Too many visitors is tiring. You can visit any time of day, but we know patients do better if they keep a day-night pattern. For that reason, visitors are asked to leave overnight unless there is a pressing reason for them to stay. 2 visitors at a time is the maximum. There isn't much room with all the machines, and mobile phones are discouraged as they create disruptive noise and can interfere with some equipment. We encourage you to take belongings home so they don't get lost.
When I first came around and they extubated me, I really didn't want anybody there but my husband. I felt very disorientated and didn't like anybody seeing me like that, and didn't know where I was and didn't know what was happening. And I did feel very tired after people visited, but I really enjoyed knowing that people were there, because it can feel quite isolating being in that room on your own. I couldn't concentrate on books and stuff like I usually could, so it was really good to see people. But yeah, 2 at a time is good. Any more than that and it gets quite confronting.
With the visitors, it's good the fact that there is limited visitors, because obviously the family member will get tired really quickly, and I think sometimes it's too many people, and so it's good that they restrict the visiting. So that, to me, that allows for rest time, because if the body's resting, then they can get better quicker.
To help your loved one's recovery, we may have to perform procedures. Depending on the procedure, you may be asked to wait in the waiting room.
The biggest issue for us on our journey was to share the care for our daughter. This was really difficult as we were so used to being the primary care provider for our daughter. As parents, we therefore put our trust in the staff of the ICU, and together we worked for the same goal, and that was the best attention and care possible for our daughter.
Social workers and ICU staff will continue to reinforce that self-care is very important when you have a loved one in ICU.
Hi, my name's Robin. I'm one of the physios in the ICU. When you come in, you're going to see a lot of different machines. The main one that you're going to look at is the ventilator. So if your loved one's got a tube in their mouth, that's what's keeping them breathing. I look at that a lot to make sure that the chest stays nice and clear. If we can see anything on there, then we'll do some treatment there. We go in and do some percussion, some vibrations on their chest and make sure it's nice and clear, and then we'll use the suction catheter that comes out of that tube to get as much up as we can. In the later stages, when that ventilator comes off and the tube is removed, we'll do a lot more of the physical, getting out of bed, walking, getting back to normal function as you would as you're at home. What you can do to help us is give us as much information as you can about their pre-morbid, how they were before they came into hospital, and just getting them to do their exercises when they're more awake. 。
We can give you updates on the phone, however we need to maintain confidentiality and privacy.
My last suggestion is to request a visit from the social worker. They may not be able to attend immediately, but when they do come, they can help you with a variety of issues, whether it be car parking, accommodation, or even helping you establish a routine of visitation schedule so that visitors and your family don't exhaust the patient.
Part of my role may include developing a communication plan to ensure all relevant family members receive the most updated information. We ask that each family member has a representative or spokesperson who is a point of contact for staff and who will also be the primary person contacting ICU to inquire about the patient.
I hope this has been of assistance to you, and I wish you all the best.